A warm welcome to the programme for all of you watching on PBS and around the world. Singapore's health ministry says it's confirmed over 1,000 further cases of coronavirus, taking total infections there to more than 10,000. The vast majority of cases are among migrant workers who live in crowded dormitories, and Singapore is now facing questions about why more wasn't done to address this vulnerable group, as Karishma Vaswani reports.
Confined to breeding grounds for the virus. Over 300,000 men live in dormitories like these. They are Singapore's army of low-paid migrant workers, mainly from South Asia, and now account for close to 80% of this city's infections. This gleaming skyline was built by them. Once hailed as the gold standard approach in fighting the virus, Singapore's reputation now tarnished because of infections spreading amongst the workers. And this is where most of them live. Several of these dorms have been sealed off to contain the spread of the virus. Crowded, cramped quarters, sometimes as many as 20 men to a room. I spoke to one who didn't want to be identified. More than a week ago, one of his roommates tested positive.
Positive man is this bed on.
Corona positive. So
we're all living in fear. We don't know if we have it or not. He was right next to us, in the next bed. I heard that 2 other people were found to be positive in the next room. We're all staying together, and no one has done anything about it. We're all at risk.
What do you think could have been done earlier?
They should have isolated us. It is necessary, and they could have done it sooner.
Help is now on its way. Medical supplies, daily meals, and more testing provided by Singapore's government. And even with several thousand infected, there's not been one death amongst them. The workers are grateful, but critics say this could have all been avoided if officials had acted earlier.
There are, in Southeast Asia alone, about 10 million migrant workers, a fraction of them in Singapore. We're not perfect, but we do what we can. Yes, we took some safe distancing measures within the dormitories, and if we were to be able to rewind the clock, one could say that these safe distancing measures needed to go much further.
It's a systemic problem, one that won't change until the entire system does. The pandemic has brought to the surface the flaws in Singapore's society, and it was the failure to address these cracks that now threatens even their best-laid plans. Karishma Vaswani, BBC News, Singapore.